If you've ever looked at a medicine label and seen the words, "take with food," you might have paused and wondered what that actually means. Do you need to eat a full meal first? Can you just have a snack? And what happens if you don't follow that instruction? These are good questions, and understanding the answers can help you take your medicine in the safest and most effective way. Let's talk about what "take with food" really means, why it matters, and how you can make sure you're doing it right. What does "take with food" mean? When a medicine says, "take with food," it means you should not take the medicine on an empty stomach. You should eat something shortly before, at the same time, or right after you take the medicine. It doesn't always have to be a full meal. In many cases, a small snack is enough. What's important is that there's some food in your stomach when you take the medicine. Here are a few examples of what counts as food in this context. A sandwich, bowl of cereal, or plate of rice. A slice of bread or toast. A banana, yogurt, or granola bar. Crackers with cheese or peanut butter. A cup of milk or tea with biscuits. Some medicines need a full meal, while others are fine with a light snack. If you're not sure which one applies, ask your pharmacist or healthcare provider. Why is it important to take some medicines with food? Taking medicine with food isn't just a random suggestion. There are real medical reasons behind it, and they usually fall into one or more of the following categories. First of all, to protect your stomach. Some medicines can irritate the lining of your stomach if you take them on an empty stomach. This can lead to symptoms like nausea, stomach pain, heartburn, or even more serious issues like ulcers over time. Food acts as a protective layer, helping to prevent these side effects. When there's food in your stomach, the medicine has something to mix with, which softens its effect on your stomach lining. A common example is ibuprofen or other nonsteroidal anti-inflammatory drugs, NSAIDs. These are often used to relieve pain or reduce inflammation, but they can cause stomach problems if taken alone. That's why it's better to take them with food. Another reason to take your medicine with food is to help your body absorb the medicine. Some medicines are absorbed better by your body when there is food in your stomach. Food can help the medicine move more smoothly through your digestive system or trigger certain enzymes that improve how the medicine is taken into your bloodstream. If you take those medicines on an empty stomach, your body might not absorb them properly, which means they won't work as well. That can make your treatment less effective. Another reason to take your medicine with food is to reduce unpleasant side effects. Some medicines enter your bloodstream very quickly if taken on an empty stomach, which can cause sudden side effects like dizziness, nausea, or feeling lightheaded. When you take these medicines with food, the food helps slow down how fast the medicine is absorbed. That gentler, slower absorption can reduce the chances of getting side effects. Skipping food when your medicine label says, "take with food," might not seem like a big deal, but over time it can cause problems. You might experience more side effects, your medicine may not work as well, or you might feel sick after taking it. In some cases, it's okay if you occasionally forget, but it's not something you want to make a habit of. Following the instructions the right way helps your treatment work better and keeps you feeling more comfortable. But here's another question: do you always need a full meal? Not always. Unless the instructions say specifically, "take with a meal," or your doctor tells you otherwise, a small snack is usually enough. The key is to avoid taking the medicine on an empty stomach. But if the label does say, "take with a meal," then it's better to have a proper meal that includes some fat, protein, and carbohydrates. That kind of meal helps with the absorption of certain medicines that rely on those nutrients. Now here's another question: when exactly should you take it? Before, during, or after eating? This is a common question, and here's a simple way to understand the timing. If your medicine says, "take with food," that usually means you should take it either during the meal or within about 15 to 30 minutes after eating. If it says, "take after food," then you should eat first and wait 15 to 30 minutes before taking the medicine. If it says, "take before food," then you should take it on an empty stomach, usually 30 to 60 minutes before your meal. If the label doesn't make it clear, or if you're still unsure, don't guess. Ask your pharmacist. That's what they're there for. Understanding what "take with food" means can help you avoid unnecessary side effects and make sure your medicine works the way it's supposed to. While it might seem like a small detail, it can have a big impact on your health. The next time you see "take with food" on your medicine label, remember that it's not just a suggestion. It's part of your treatment plan. If you ever have doubts about how to take your medicine, don't hesitate to ask your pharmacist. They can guide you with clear advice, tailored to your specific medication and health needs. Thank you for watching. Don't forget to like this video and subscribe to our channel.